I'm Desiree Taylor, and this is my Human Disease Quarter 4 project. Hello there! Today we will be talking about diabetes mellitus. Diabetes mellitus is when the body is unable to produce or respond to the hormone insulin. In this case, there is an abnormal metabolism. Carbohydrates and the level of glucose will be elevated in the blood and urine. Basically, it's when there's too much sugar in the bloodstream. There are 4 types of diabetes mellitus. There is prediabetes, which is a condition in which the blood sugar is high, but not high enough to call it type 2 diabetes. Then there's gestational diabetes, which is a form of high blood sugar affecting pregnant women. How we treat this is we just give them insulin as one of their prenatals. These 2 types of diabetes are fairly uncommon to see. Let's move on to the most common types of diabetes, type 1 and type 2. Starting off with type 1 diabetes, this is the condition in which the pancreas produces little or no insulin. When it comes to type 1 diabetes, you'll most likely be born with it, though it can show up later, sometimes due to prior illness. Unlike type 1 diabetes, type 2 diabetes is mostly found in adults. Type 2 diabetes is when a body that once produced enough insulin stops producing a normal amount. When it comes to treating both types of diabetes, we use insulin. However, when it comes to type 2, we recommend you change up some of the things in your lifestyle to prevent it from getting worse. Some symptoms of diabetes mellitus is increased hunger, darkening in the skin, fatigue, and blurry vision. When it comes to type 1 diabetes, symptoms sometimes show up after a child has gotten over a cold or illness. This is because the homeostasis in their bodies has been interrupted and insulin cannot be produced as fast. Depending on how severe your diabetes is, you might have to take insulin every day. However, most people with diabetes must check their blood sugars to make sure their levels aren't too high. If someone with diabetes doesn't take care of themselves, they can end up very sick or even hospitalized or comatose from a sugar coma. One myth I would like to clear up about diabetes is that people who have it cannot have sugary things or sweets. This is false. People with diabetes just need to regulate their sugar and count their sugar intake more carefully. Actually, sometimes things that are healthy for us can bring up our blood sugar more than other things. Let's move on to some patient evaluations. This is Tori. She is 25 years old. She's a fashion designer. Tori has always been a very healthy person. She eats the right foods, and she exercises daily. When Tori was 5, she was diagnosed with diabetes and started to take insulin injections. Ever since then, Tori has taken 1 insulin shot per day, more if more insulin is needed, and has tested her blood sugar twice a day. What type of diabetes does Tori have? That's right. She has type 1 diabetes. We can tell because of the age that she was diagnosed with and the fact that she has otherwise lived a very healthy life. Next, we'll talk about Nate. Nate is a 20-year-old gamer who rarely goes outside and eats a lot of junk food. He recently came to the doctor's office complaining of ear pain and also extreme hunger and thirst all the time. His doctor ends up diagnosing Nate with Diabetes. What type of diabetes does Nate have? That's right. Nate has type 2 diabetes. So that's it. I hope you guys learned a little more about diabetes mellitus, and I also hope you enjoyed it. So I'll see you guys later then.